I'm privileged to welcome Professor Salem Abdulrauf in Bulgaria and Varna. This is probably the most celebrity neurosurgeon that has ever visited our country. We are very happy and proud to be his host here in Bulgaria. I'm sure that Professor Abdulrauf doesn't need any presentation. You are familiar with his achievements in the field of neurosurgery. He's a well-recognized expert in the field of scalp-based and vascular neurosurgery. So I hope that I'm sure that you will enjoy his lectures. You will have also the chance to hear his lectures again in our main Congress 2 days later. So now I would like to invite Professor Karpatska, the Vice Rector of Medical University of Varna, to welcome our guests.
Dear distinguished guests, dear colleagues, dear students, it's a great pleasure for me on behalf of the Rector of Medical University of Varna and to present you the welcoming address of the Rector of Medical University. Dear colleagues, the third Congress of the Danube-Carpathian region, Controversies in Neurosurgery, will be held from May 29th to May 21st. The Congress will gather some of the most distinguished neurosurgeons, not only from our country and the region, but also well-known specialists from Europe, United States of America and Asia. Scientific fora like this provide a scene for professionals and experts to share knowledge and experience from their practices, ask questions and find answers. Such fora give an impetus to science and clinical practices to advance.
Thank you, Associate Dean Skova and Associate Professor Inchev. It is my honor to be here. This is my first visit to Bulgaria, and it is indeed humbling to be here with you, my colleagues. Some of you traveled very far away to come here from many countries, and I'm very honored for that. What I want to do today is a very interactive session with you. This is not going to be a typical lecture. There's going to be a lot of back and forth between myself and you about anatomy and the way a neurosurgeon becomes a confident surgeon if the neurosurgeon can three-dimensionally visualize the brain. If somebody shows you an MRI, an axial MRI with a lesion somewhere in the brain, you have to be in your head, be able to visualize exactly where that is, where that lesion is, in the center of the head or wherever in the head, and you should be able to, with significant accuracy, identify just by looking at one cut where that is in the head. And I'm going to spend a lot of time in that concept with you today. But to be able to know that, you have to know a lot of relationships. I don't care if you know names of anything. Names is just for fun. It doesn't help the patient in the operating room, right? What is important are the relationships between the various structures. And that's what I'm going to stress with you. What is relevant is, can you understand the relationships among structures? So in neurosurgery, if you are working any lesion that may cause a neurological deficit, you have to believe in your mind is worth buying or not. Okay? There are not many things for which you're willing to accept a new significant neurological deficit for. That is the frame of mind by which we have to make decisions. It's not just because I see it, I can operate on it, I'm an operator on it. It's not that thinking, okay? It is a very different kind of thinking that has to be had about making decisions for patients.